Welcome to Generous Impact. This is Bret Brummitt.
And this is Amanda Brummitt. We are joined today by Ira Kaufman, a rabbi, social worker, and healthcare executive. Today's episode isn't about a particular organization, but rather how Ira spends his life serving his community. Ira and I met through his day job, Halcyon IV, and I often thought about their approach to caring for people after we spoke. Their language around healing people with dignity and hope was so kind that it always stuck in my head. So when I reached out to Ira to dig into possibly doing an episode around that and how they care for patients, I learned that it's a much bigger story than just one organization. When Ira sees a need in his community, he seeks to meet it, or rather, as you'll hear, is often tapped to figure it out. And this has crafted a life for him, his wife, and children of beautiful service to the community. In addition to his day job, he serves 7 other organizations in the community. We'll only cover a snapshot today, but I hope you find it as inspiring as we do. Well, Ira, we normally lead off with our guest's background, but I would literally need an entire 8-episode Netflix documentary to do that with yours because it is so impressive. Can you give us kind of the movie trailer version of your background and education, and then we'll dive into what we're actually here to talk about, your volunteer work?
Okay, yeah, absolutely. So I guess my world started as a typical Jewish Orthodox boy going through Judaic school and going through, obviously we had secular studies. I went to high school in New York and then moved on, continuing on in rabbinical school, and got my ordination in the largest school in New Jersey, which is Beth Medrash Gavoa. From there, I joined the Cincinnati Community Kollel, doing more outreach and rabbinic work, thinking that my world's going to end up in congregational rabbi world, which it did for a little bit, which we'll probably discuss at some point. And that was where I thought I was pretty much at. Through Beth Medrash Gavoa, I got my bachelor's in Talmudic literature, and I was moving on to get my master's from them as well. When I moved to Cincinnati, I did my chaplaincy education through Emory University and in Atlanta, Georgia, and then I continued on to a master's program, a master's of social work with Wurzweiler School of Social Work in New York. I guess that's where my education world. My background was a boy growing up in New Jersey. Thought that I would live there forever, living the regular New Jersey life, not knowing that there's much more out of the New York, New Jersey world, and then finding that there's suddenly a Midwest and there's a larger country out here, that there's a lot to do.
Yeah, I had always wondered how a New York or New Jersey person ended up in Cincinnati.
Oh, yeah. There's just been a lot of mistakes in my world, but I enjoyed summers going to different communities. Every summer I would choose a different community, and there was a seed program that connected us to different communities. It was much more of like a scholarly work of being able to do outreach within different communities and being able to offer some of the studies within different communities. But that suddenly opened my eyes to seeing so many different communities. And then there was a program where I was living that was made for rabbis that were thinking of moving out. And they asked me to join, and I said, absolutely not. You know that I'll never leave. I'll never be leaving New Jersey. My wife's from New York. I'm from New Jersey. Don't ever think that we'll leave. And they just pushed me, and they were like, well, there's no commitment. And even though for most people it was a commitment, and they were like, we just want you part of the program. And once they did, then there was different interviews coming, different people coming from different communities. And when Cincinnati came up, honestly, there wasn't the same ring as when I looked into Palo Alto, California, or Phoenix, Arizona. Those seemed like cooler places to me than Cincinnati, Ohio. And it didn't have that ring, but there was nothing that I heard. I mean, I only heard good things, and I was like, okay, I'll go check it out. Just to know that we can rule it out that way, to check that box that it's not going to happen. And I went a day before my sister's wedding, and I came to Cincinnati, and I came back, and my wife said to me a couple days later, "You never even told me. Like, we were so busy with the wedding. You never told me what happened in Cincinnati." And I was like, "Oh, I was waiting for a good time to discuss it because it was actually really nice." And that's when we came together, we checked it out, and that's history.
Yeah. So from big family in New York, New Jersey area, a large community. I mean, going into Cincinnati, I'm sure that took, wanting to make that move. I mean, how did you see yourself as growing as a person through that transition? Or was that even something you thought would be happening at that point?
So, oh my gosh, it was a huge growth. And I honestly, I didn't realize what I was getting into, and moving to a smaller community. So there were multiple aspects that suddenly came about. First of all, going from the large developed community to a smaller community where there's just so much more opportunity, so much more opportunity. I would say all the things that I got involved with, that was, I would say most of this would never have happened if I was in the larger, more developed, larger infrastructure. A lot of that is already developed, and I would never have had the opportunity. But another thing that I suddenly learned was New York, New Jersey, and I can say this because I'm from there, is is very fast paced. People are very fast paced in their personalities as well. I'm saying that politically correct. And they don't always have the space for another person in the same way that a Midwestern person would be able to give that consideration to another person. And that was suddenly something so beautiful that I feel like I grew in, and I developed, just being able to recognize the beauty in every single individual and other people. And being in a New York, New Jersey, you're not necessarily exposed to everyone else and the rest of the other communities around you and the other cultures, which is something so beautiful that I've been able to see since coming to Cincinnati. So I'm forever grateful for this.
Do you feel like it's like a gift of the interloper? Like you get to be from two places, but you could see them both?
Yeah, because I still know how to drive like someone from New York, New Jersey. So I'm able to pull the both sides of that. Yeah, I guess.
And Ira, Bret alluded to you having a large family. How large is your family?
So I come from a large family, and my personal family is quite a large family as well. We have 8 children, and so it's quite busy at home. And I would say that often my work time is my downtime, and then I need to gear up. And once I get home, that's when it's actually busy, and I need to be in full swing and be fully alert to help out.
Nice.
And my wife is taking care of the family, doing an amazing job along with the other things that she does. But yes, there's quite a lot going on in terms of family.
Yeah, definitely. And then one more question before we dive into what we're actually here to talk about. Can you tell us a little bit about the Jewish community in Cincinnati, as it seems like their unique needs have inspired a lot of the projects that we're going to discuss?
Yeah, absolutely. So Cincinnati is, I would say, quite a large community, a large Jewish community, and it's an older Jewish community. But the Jewish community at large, so when I'm saying the Jewish community, I'm including the Reform Conservative. That's always been a very stronghold in Cincinnati. The Orthodox community has been much smaller, and a lot of my work is been within the Orthodox community. But the Orthodox community is a smaller community. The Orthodox community has about 400 to 500 families. I'm maybe being a little generous on the 500, but it's I would say about 400 Orthodox families. And the Orthodox families are often larger families, so the amount of people are quite significant. There's 2 Orthodox schools, there's multiple congregations, and there's just a lot of great things going on.
Well, let's dive into the projects then. So your family started, and I'll make sure I get this right, the Bikur Kalim of Cincinnati. First of all, did I get it right? Correct the pronunciations, please.
Pronunciation it's a little bit of a hard word. It's Bikur, and I say it with the hard ch, so it's the Bikur Cholim of Cincinnati. So that is so there was a Beaker Cholim here before, and I give all the credit for them of all the work that they did before we started. We got involved on their footsteps of what was going on already. But honestly, it was quite a challenge when we started. There were families, and I'll just give a little explanation of what the Beaker Cholim does.
Yeah.
Is and I'll start with just a little bit of like a little bit of a story, and it's all the credit to my brother-in-law. He came here, it was just a few months after we got here, and again, I was studying. I didn't think anything about local medical needs or patient needs. That was not a focus of mine. It's not something I thought about. And my brother-in-law was here for a weekend as a visitor, just here with a patient in Cincinnati Children's Hospital. And he comes to me after Shabbat ends, and he says to me, "Do you know that there's families that are in a hospital just 15 minutes away from your house that are eating pretzels and potato chips because there's limited kosher food?" And I was like, "Okay, that's horrible, but what do you want me to do about it?" And he was like, "Well, you have to fix it." And I was like, "Well, what do I
You're the
do?"
guy. You're the guy now, right?
Right. So he said, that's like, it's like he tapped me. I was like, "Okay, you better do this." But like, I said to the mayor, what do you think I'm going to do? Like, am I going to go knock on the front door of Cincinnati Children's Hospital and say, "Okay, now it's time for you guys to have some kosher food"? Like, how's that going to happen? And so he responded to me and said, "I hear that is a problem. I don't know the answer to that. I guess we don't really have a way of doing it." And I was like, "Okay." Conversation ended. Like, I don't have to think about this again. Suddenly Wednesday, so that was Saturday night. Wednesday morning, he calls me up and he says, "Can you make sure you get a freezer, get the largest freezer you can possibly get, and make sure that it's being delivered by Friday." And I was like, "Mayor, what are you up to?" And he says to me, "Just don't ask questions. Just go. I asked you to go get a freezer." And I was like, "It doesn't go like that. You can just go get a freezer on Wednesday and make it delivered by Friday morning. Like, you need to order it, like, and wherever I'm going, whichever store I'm going to go to, it's a 2-week delivery and whatever it is." And so he was like, just figure it out. Go do it." So anyways, I walked in, like, I'm calling multiple appliance stores, and they all like, "Okay, it's a 2-week delivery kind of turnaround, like even expedited, like I would have it like the beginning of the following week." So I just walked into Lowe's and I was like, "Okay, what can I take off the floor?" So they showed me a freezer I can take off the floor, and I was like, "Okay, can I have it delivered by tomorrow?" So it was Wednesday afternoon. They delivered the freezer the following day, and I'm still not sure what's happening. Suddenly on Friday morning, I have FedEx shows up with these 5 boxes of frozen food. So my brother-in-law Mayor, he had a caterer in Muncie, New York, prepare. It was over 100 meals. He had them prepare these meals. They froze it overnight Wednesday night, and then they shipped it to me overnighted with dry ice, and it came pretty frozen still on Friday morning. So I called him up. I was like, "Mayor," I sent him a picture. "I have this full freezer now of over 100 kosher meals." I was like, "But I still don't have any access to the hospital. Like, what am I going to, what do you want me to do now?" And he was like, "I get the problem, but now any family that you see that's in town, if they come to service, if you see them, just let them know that you have kosher food for them." And make a long story short, that's really the way it started. Was I would just go over to families and say, you know, "I know that there's limited kosher food in the hospital. I have food for you. Can I give you a bag of a few meals?" And then the following day, and then word spread throughout the hospital, like, "Oh, if you need kosher food, then go to Rabbi Kaufman. He has food for you, and he'll get you set up." Friday afternoon starts Shabbat, is the Jewish Sabbath, and Friday at sunset. So I would show up to the hospital, and so I had no access to the hospital anywhere, and like I would just show up on Friday afternoon and say, either call the chaplain on call social work, ask security to help me to just get up to a patient room, and I just need to deliver this kosher food for them. And I became the consistent nudge of someone coming on a Friday afternoon, running against the clock and trying to bring food, until, like, from one thing to led to the next, started with that the hospital started asking me to do. There were different cultural aspects that the hospital was was very interested in learning, but less aware because they didn't have an Orthodox person on staff. So they would loop me into different cultural sensitivity trainings and different things that were going on. And I was doing these trainings one after another because they were really interested in learning. And at one point, Judy Ragsdale, the director of pastoral care at the time, asked if we can go out for coffee after one of my trainings. And she was like, "Would you ever think about joining our staff?" And I was like, at that point, like I was ready. I had moved over to congregational work. I was like, no, I'm totally, I have a good gig. I'm not thinking of hospital world. It's not my world right now. But she planted that seed. And that's when a little bit after that, I learned about this program in Emory University of, of doing online chaplaincy training, doing, doing CPE online, which was, which was incredible education as a chaplain. Like, I mean, I think anyone in public service should have some level of chaplaincy training, and for sure anyone in congregational work. I think it was just an incredible education. And I did all my education through Emory University, doing my clinicals at Cincinnati Children's. And then I ended up joining their staff for about 5 years.
I do want to back up a little bit because I'm real curious because I just don't know. Like reading through some of the services and the pastoral care, guiding families through the healthcare system and coordinating with the Jewish law. What is different? And are you the one involved mainly doing that?
So I am the one that's mainly doing that, yes.
Mhm.
So what's different is there's different ethical ways of looking at things that sometimes can be different than Western culture, medicine, especially around decision making, medical decision making. The way of families will often want to consult with a rabbi either for prayer, or in addition to that, there's a cultural aspect of, sometimes it's a trust, and sometimes it's being able to hear it from someone within the community. And I'm not going to do my whole cultural sensitivity training now, but I do look at that there's an element of, I say a communal trauma around the medical world. And there's often a family that's going to hear it from one of their people. Then so there's also within the Jewish community, there's been referral agencies that really delve into, and some of them are medical professionals, and some of them are even lay people that really delve into researching different medical outcomes between different physicians, different medical centers, where they specialize in specific medications, where they specialize in specific treatments. And and families will often consult with one of these referral agencies just to hear, like, am I going to the best place? Am I going to the place that can really help my child? Or am I going to the best place that can help my loved one? And so I had this one morning, it must have been 6 a.m. Patty Manning, at the time, she was the chief of staff of Cincinnati Children's Hospital. She called me one morning. She's calling me on my cell at 6 o'clock in the morning. It was like a little weird. So I answer. I said, "Patty, what's going on?" And she says, "Well, there's a family here that's rejecting, and they're refusing to go to surgery because you didn't sign off on it. And what in the world is a rabbi need to sign off on the medical treatment for?"
Mhm.
And I was like, "Well, I don't know what that means. Let me talk to the family." It turns out the family came for a specific doctor. They knew a specific doctor's name. That's why they arrived at the hospital. And they were technically willing to do the surgery, but because the surgeons were changed on them last minute, they were like, "We don't know that surgeon. We're going to do our research." And the way they were going to do their research is by asking me. So they said until they hear from me, they're not willing to go into surgery. And I was like, it's a shame that the hospital doesn't always understand that, of like, it's not that they need a rabbi to sign off, and I'm not holding back anything. It's just, it gives a certain level of comfort that they heard it from me, that yes, he's one of our top physicians. Yes, he's an excellent surgeon. And which sometimes keeps me on my toes. It's like making sure that I'm up on knowing who the medical professionals are locally.
Yeah, you got to know everything at that point.
Yeah, somewhat.
Yeah.
Well, and it sounds like a lot of times you may just be delivering peace of mind that, yes, this is okay. Yes, you can trust these people.
Right. So a lot of it is that peace of mind. It's also there's another element is, I would say, and again, I'm focusing on families that are coming from larger communities, but even not, there's the Jewish community is very community oriented. And I would say, especially the Orthodox families, that if you look at the Orthodox population, they're always living together. And the reason for that is just a very simple reason, is because there's no driving and there's no use of no activating electricity. We're allowed to have lights on, but we would have lights go on before Shabbat. So we're not turning them on. So nor are we driving to a congregation. So everyone needs to be within a walkable distance. So everyone's usually within a 20-minute walk of any given congregation, so that it just populates those areas. People know each other, and it's a very community-based kind of feeling. So when someone is suddenly in a larger hospital system, they're not connected with their community, that they really feel isolated. They feel disconnected. And having someone that's going to be coming around, checking on them, seeing how they're doing, is just giving them that comfort of what they're familiar with. And it's a very strong feeling when everything else is there. They lose their autonomy in the hospital, and they lose control. And suddenly you have someone that you can connect with. It just gives that sense of comfort in a huge way.
Definitely. I mean, most things in a hospital are scary. So let's take the things that we can control, like giving them access to food they're comfortable with, and let's control those pieces because those don't have to be scary.
Right. No one chooses to be in a hospital. And even when a hospital worker, and this has been a challenging for me, is like to constantly look back, is the small surgeries which the hospital doesn't look at as any level of crisis, and everything is totally like, they know the outcomes, they've done this thousands of times. It's totally okay. But for a family going through it, that's a crisis. Anything in a hospital, they're coming in, right? And it's all crisis for them. And it's always like reminding yourself like that there's a heaviness that the families are walking around with in a hospital.
Yeah, definitely. Okay, so and you're still a chaplain at Cincinnati Children's, right? And now your wife actually runs the program dealing with meals and things like that.
Yeah. So my wife is the one running all the coordination of the meal programs. There's months that we're putting out. Right now, we can hit 500 meals in a month.
Wow.
There's hundreds of rides a month based on people coming in and out of Cincinnati. If people that flew in, that are wanting to go to services, if they're wanting to go to a kosher restaurant, just assisting families while they're here. So yeah, my wife does all of that. It was too much for me to be doing everything, and she's amazing at coordination. So she's really running the whole program. I'm still on the staff at Cincinnati Children's, and I'm their PRN now. So I'm there as needed. Generally Friday afternoons before Shabbat, I'm doing the education for staff, making sure that they're aware Shabbat's coming, that this family is going to be observing Shabbat, and and what that entails, of how to navigate within a hospital system that everything is electric and the family's not going to be activating electricity. And incredible that because we had this awareness, the local hospitals here have really moved to such a strong, caring and understanding place, and like working through protocol to make it work for families.
Beautiful. I love to hear that. Well, let's jump to a different program. Can you talk to us about the Hatzala of Cincinnati? And as I understand, this is a volunteer ambulance service for everybody, not just people of a particular faith. So yeah, can you tell us about it?
So here's the first time it's being spoken about.
Oh,
It was not announced to the community just yet. So Hatzalah Cincinnati. So there's many communities that have a Hatzalah organization. Hatzalah is the largest volunteer EMS organization in the world. And there's many branches in many different communities. And we're excited to be opening one here in Cincinnati. It is all staffed by all volunteer staff. So all the EMTs, dispatchers are all volunteer. One thing we're excited about is we have a medical director that's volunteer now, and so it's quite incredible to have like a full staff of people. What's incredible about Hatzalah is really two aspects. It's people that are trained as EMTs or paramedics that are regular people that are holding regular jobs. So it can be an attorney, an attorney in one place, myself being an healthcare executive director. It can be a nursing home administrator. It can be an Uber driver that is running their day-to-day life. And when suddenly there's an emergency, it's stopping what they're doing and responding to that emergency. So it's regular people are going about their regular day, but suddenly when that emergency comes, is that they're here to help another person. And what it does is that we're staffed with many people within the community, around the community. And Hatzalah is not set up the way the typical EMS is. That you're just waiting for that call and go run and get an ambulance and come back. If the person's in your congregation that needs medical assistance, the person's your neighbor, the person's on your block, then you have all the equipment in your personal vehicle, run over and be that first responder until 911 shows up, until more, and you have everything. You have your full jump bag ready to support that patient until more and higher level of service is able to arrive. So it's really bridging that gap. What we're doing is bridging that gap. We're not starting with any ambulance services. There are Hatzalahs that are more developed that have ambulances as well and will respond, but there's always those first responders that are arriving with everything to help that patient right away.
that's incredible. And I assume it's free for patients?
It's free for patients. There are some Hatzalahs that when they're able to bill insurance, then they do, but it's not something that we're looking at right now for multiple reasons. It's just an easier setup not to do that. And especially while we have EMT basic legalities, it's not really realistic if we're not doing transport. So that's, yes, entirely free for patients. And it's fundraising within and around the community to be able to support it. And once families feel that that's an important need, the 911 system that we have here is a really good system. At the same time, they're not based necessarily within our congregation, within our few blocks, and within our immediate area. And their response time is a typical 911 response time, which takes some time till they're able to get there. So we're hoping to be able to bridge that gap and to be able to provide for patients much quicker until the 911, and then be able to work with them simultaneously.
Yeah. So will the 911 actually dispatch you guys?
No, we'll have our own dispatchers, and we'll coordinate with 911.
Yeah. Wonderful. Okay. And then ignorant question, how does that work on Saturdays?
So that's not an ignorant question.
Okay, good.
So when it comes to any medical emergency, then Shabbat is lifted. I wouldn't say Shabbat is lifted. It's part of the respect for Shabbat, and part of the respect for everything that we do is to ensure that this person that's in a medical emergency should be able to observe many more weeks of Shabbat, and to be able to have that for future time. So it's absolutely like when there's a medical emergency, then everything gets done. And if it means activating any electricity, driving and and using whatever is needed to be able to assist that patient.
That makes total sense. Thank you so much for explaining that. Well, Ira, while I want to talk about every single organization you're involved with, I know we've only got a limited amount of time. So the last two that I'd like to cover, if you can, are the Burial Society and the ritual baths that you oversee.
Yeah, absolutely. So the Burial Society is I got involved pretty much. This was my first volunteer thing that I got involved with when I joined the community. I was asking what there is that I can do for the community, and Rabbi Spetner advised me that I can look at the Burial Society, and I was like, that's not something I do, but I tried it once, and there was really something really meaningful about being able to both what we do is be able to wash the deceased and saying some prayers and preparing them. What we consider is the journey for the world to come, and sometimes people don't know that the Jews also have a world to come, that there's a heaven. But yeah, and what we're doing is we're preparing the deceased and assisting families through end of life decisions and a lot of very, very difficult times. So that's something that we assist with. The ritual bath is referred to as the mikvah, and that's something that people use for spirituality. And so that was just near the congregation that I was working with. So I was often on site, and like when there was something that needed to be done, I was the guy that was around. So somehow that suddenly became my I don't call it responsibility, and opportunity to be able to be involved in. And so right now I assist them quite a lot, but that's something that it's a spiritual aspect of our community, and something that we take pride in.
It seems like this is a theme. There's a need, and somebody goes and finds you.
Well, and you are also still the assistant rabbi of your congregation, correct?
Yes.
So Saturdays, it's not an off day for you.
Oh no,
That's
it
work
is not
as
a day
well.
of rest. Yeah.
Yeah.
Yeah, Shabbat's supposed to be a day of rest, but no, I run our early morning service, starts at 7:15, and then I have my Saturday morning class afterwards, and then I give a Saturday afternoon class. So yeah, Saturday is not an off day for me in any way.
How did you come to see this as a lifestyle for you that you wanted to choose? Like, how did you decide you wanted to be on 24/7 and then on 1.5 times when you're home with the family?
So I guess I came to that realization at some point is I guess what makes me feel accomplished is when I'm overwhelmed, if I have to say that. So I mean the answer is I don't know. It's just been the way of life, and but at the same time, I strongly carve out family time and date night with my wife, and making sure that we have strong family time as many things that are happening. I mean, there are times I'm not going to say I'm a great boundary person. There are times that we've been on vacation and I'm on the phone with doctors in the hospital. That happens. At the same time that happens, there's also great family time and a strong focus on making sure that I'm present. And often my wife needs to remind me that I need to be present. But that's it's busy, it's hectic, but I don't know another way right now.
Yeah. And is that anything, did you see anybody that did that growing up, or is that just something that you found along the way?
I was inspired by the people that were really there and present helping community. And that was something that always inspired me. And that's something that I look at and say, okay, those people were in larger communities and were their one thing that they're doing took up all of that amount of time. And that to me, I look at that and say, like, okay, I still have a little bit more room to be able to give, and I want to be able to help the community in another way. And to be honest, like for Bikur Cholim, like my wife is running it. Like I take a strong pride in that I did that work and I started it, but at the same time, she's running it, and that frees me up to be able to do a little bit more.
Yeah, a beautiful partnership. So, Ira, let's switch a little bit more to the business side, which is actually how you and I met. Usually, when I talk to somebody about their company, the short version is show me the money. But when I spoke with you and your team, it was super clear that you guys cared a lot about humans and taking good care of people. So, my question in all that is that you've managed to weave being a good person into your work and your personal life. I want to know what your advice is on running a healthy business that also does right by people.
So I think that it works really hand in hand. Is the more that you see the beauty in another person, it really shapes who you are at work, and just what feeds you and your team, being able to work as a team player, being able to recognize, obviously we all need to walk home at the end of the day with a paycheck, and we need to be able to do business has to go well. But at the same time, it's being able to be there for your staff, being able to recognize and being a team player if something's going on for another person, if there's something that's happening, and we can have a very strong, healthy business, and which we do, thankfully. And at the same time, being able to be there for one another and being able to be caring if there's something going on in their family, something going on with them themselves, someone's having a harder day, someone's struggling, like, and just being there as another support person in their life. And it just doesn't have to be that cold colleague element, but rather caring. So I think not only that, but I think that creates a healthy business. Is when people feel supported, they want to show up for work. They want to show that they want to be able to produce more. They want to be able to do and be there for one another. People are not, I would say the majority of people are not coming to work just to get a paycheck and just to check their box. They actually want to feel fulfilled at the end of the day. And I think that what we're learning more and more is people, not only that, but it's the majority of their day they're at work. They want to feel cared for. They want to feel that they're respected. They want to feel that the leadership of their company are not just using them, but they're part of the team and they care for them. And that's what I feel, that every element of my life, being a rabbi. I was just asked this the other day, is like how can you you probably not you can't do well in business because you're a rabbi. And I was like, I think it's just the opposite. I think that every element of my life, being a rabbi, being in congregational work, my chaplaincy work, seeing people in crisis, being a licensed social worker, and being a healthcare executive, works all simultaneously, being able to both be there for our patients, be there for, and being focused on a mission to be caring for patients, and at the same time being able to be there for the staff.
Yeah, I totally agree.
You're making me remember I was introduced to a book by Steve Davis. He's the current CEO of Cincinnati Children's Hospital. I'm forgetting the exact title of the book, but it was something of put your patients second. And everyone's into that thing of put your patients first.
Yeah.
And it's it's something along that line.
Is it Patients Come Second by Britt Barrett?
Patients Come Second. Okay. Yeah.
Great book. I actually had the joy of working for Britt early in my career.
But that's something that really spoke to me so loud, of that people will only cure for their patients, and they're only cure, and it doesn't matter what business it is if they're supported and they're cared for. And that's the way I look at it.
Definitely.
Well, super cool. From all we've talked about, I want to keep going, but I know can't go on forever. So I want to ask, the big question is, what can our community do for the organizations you serve? How do you get support, and what can our community do for your communities?
So I would say there's the cliche answer, but it's really real and really true. And then there's the practical. I would say the real thing that I would love to see in communities is other communities being there for one another, being able to show up for one another. The focus of community minded, of focused on what can I do for one another, what can I do for another person is. And often I look at it, and when someone says thank you to me for assisting them, and I'm like, no, like I don't look at it as that you shouldn't be saying thank you to me. What the greatest thanks is if you do that for another person, or if I know that if I was in crisis, that you would do that for me. And I think that that's really the greatest thing that someone can absolutely do. Like that's really being there, caring, and every person has a strength in whatever way it is. And there's some element of strength that a person can see beyond themselves. And it can be a small thing, it can be an online thing, it can be a support program, it doesn't have to be starting a whole organization, it doesn't have to be something large, or it can be volunteering for and assisting something bigger than themselves. Every community has something. But practically, I mean, many of these organizations that we run do work with fundraising and assistance from our community, and that's always a practical thing. But that's not why I'm on today, is to come with a fundraising gig. What I would love listeners is if they go out to their communities, think how they can invest and branch out to do more.
Yeah, I mean, money does helps things get funded, help things get move forward. And I'm curious, does most of the community, words, jumbled words, does most of the money for your projects come from within your communities? Is it
I would say it
self-sustained,
comes
or do you
with,
have to outside?
so we do have to go outside. It's not all able to sustain itself. We do have certain donors that are really passionate about each one of the different projects, but it's often that we have to look beyond the community. And there's different ways that we think about it, and like that's always a focus. But a message that I sent someone yesterday, they were messaging me about the ritual bath. And so we do have a membership for people that are using it, and they were like, they're struggling. And my response was, it's our focus is the mission that we're here for. Our focus is not, can you come through with the membership and the numbers at the end of the day, although they're essential and they're necessary for us to function. That's not the mission. The mission is that we should be able to be there for other people in the community.
Perfect. Well, thank you so much for spending time with us and for giving us some insight into a community that we don't participate in. So it's really fun for us to learn some more. And then thank you for all you do for your communities, and really with the decency and love and just seeing the good in others that you do. And so appreciate that in you.
Okay. Thank you, Bret. Thank you, Amanda.
Wow, I am so inspired by the way that Ira, his wife, and children give back to the community. It's a family affair in the Kaufman household, with the whole family giving back to the community, from meal prep to transportation to just being there for people. I hope you'll be inspired to be there and care for your own community, as well as see the beauty in other people. Check out the show notes for links to all the amazing organizations where Ira and his family give their time and energy.